Back with us today from University Urology. We are so happy to welcome back to the show this morning Dr. Scott Caesar. Good morning.
Good morning. How are you?
Hey, I first want to say congratulations on your new baby girl. This guy right here is a new dad, and just so excited about it. I love to see how in love you are.
Yeah, she's the best.
She is. I got to see pictures. She's adorable. What I also love about you is how passionate you are about urology and making sure that you know, people that are watching are educated this morning. And we're going to talk. I don't know if I'm going to say this right. I've asked you like 10 times. How do you say this? Hematuria, is that correct?
Perfect.
All right, good, good. Yeah. So what is that?
Hematuria is a fancy way of just saying blood in the urine. It's a very general term. Very general term,
both for men and women, by the way.
Yes.
All right, but we're going to focus on the men.
Well, both. We'll focus on both. Why not?
All right. We'll talk about, I guess, what are the different, my first question to you is if you see blood in the urine, I would automatically assume to panic. Something must be really wrong.
There's no reason to panic. Now, there's different types of blood in the urine. You've described gross hematuria, which is actually you see the blood in your urine. More often or not, people actually see blood in the urine microscopically, which is called microscopic hematuria. When your physician takes just a urine sample for some other reason, they find blood in the urine that you haven't seen yourself. That's the most common type of hematuria. But yes, blood in the urine often does freak people out, but there's a very easy way to work it up, and you shouldn't panic right away, not at all.
Okay, all right. So what are the different causes? What would cause blood in the urine?
So it ranges from a wide variety of things. It can be from kidney stones. Those cause blood in the urine very commonly. Urinary tract infections. In men, enlarged prostates can also cause blood in the urine, and that's often a common cause in men. In women, they can just have some bladder inflammation from other reasons. And then, you know, the ones that people worry about are kidney cancer and bladder cancer are two reasons that can cause blood in the urine.
So again, just because you see blood in the urine does not mean all of a sudden you have cancer or it needs to be something extremely. But it does need to be looked at right away.
Yes. I mean, I would definitely talk to your doctor about it. Obviously, if you see blood in the urine, I'd call your doctor right away. You can call your urology office right away if you haven't seen a urologist before, because your doctor's probably going to refer you to a urologist anyway. Okay,
and that's what I was going to ask. I mean, is this something that you just call up your regular primary physician first?
I always tell every patient of mine that has a problem, you can always call me first, obviously, as a urologist for things I can take care of. But for patients that don't have a urologist, or this is a new problem for them, they don't know what to do, you know, that's what your primary doctor's there for. They're the gatekeepers. And if you tell them, I have blood in my urine, they might bring you in the office because they could run some simple tests there, or they might just say right away, you should go see a urologist.
All right, let's say for a second that it is bladder cancer. I guess what is, you know, what are your first steps there? What do people need to know about bladder cancer?
When people come in the office with blood in the urine, the way to work it up is very simple. The first thing they need is some kind of imaging to look at their kidneys. So it's a CAT scan, an ultrasound, something like that. And the second part of the whole workup is something called a cystoscopy. It's a very simple procedure we do in the office. You take a small camera and you look inside the bladder. Oftentimes the urologist will even have a screen next to you so you can watch while it's going on. It's under local anesthesia. You know, it doesn't cause any pain or anything like that. It takes about 2 to 3 minutes. And if something is found that looks like bladder cancer or something abnormal, the treatment or workup is something as simple as just biopsying it in the office. Or something more, you know, that is a little more substantial. Your urologist might tell you, look, we need to investigate this further. I want to schedule you for some procedure in the operating room. And usually there's no incisions or any kind of big surgery. It's just going into the bladder and kind of scraping that area and taking a biopsy, much like when people get colonoscopies, which are very common. If they find polyps or something like that, they remove them to look at them. Same thing with bladder cancer.
All right, how serious is bladder cancer these days?
Well, bladder cancer is also a wide range of seriousness, I guess you could say. The majority of bladder cancer is not invasive into the bladder. It's much like colon cancer, like the little polyps that you just pluck off. And if that's the case, then it's just surveillance. You just have to see, you're going to get to know your urologist very well if that happens, because it just means that they look in your bladder periodically every 3 months, every 6 months, things like that for the rest of your life. That's the majority of bladder cancer. Now, there's also serious sorts of bladder cancer, the bladder cancer that goes into someone's bladder. And if that's the case, that's sort of an individualized conversation that you'll have with your urologist, what the treatment could be. It could be anything from some kind of surgery to some kind of, you know, chemotherapy, radiation, things like that. But that's kind of the other end of the spectrum that isn't as common as the one that's a lot less invasive.
Well, again, there can be a lot of questions with this, but again, I think the main thing, the take home here is if there is blood in the urine, whether it be female or male, to make sure you get it checked out right away.
Yeah, because, you know, like I said, more often than not, it's not cancer. You know, you could have kidney stones, you could have bladder infections, but those are things urologists can help you with too. You know,
Okay.
if you have kidney stones that are blocking your kidney, we can take care of that. If you have infections that you keep getting it over and over again, there are ways to investigate and try and prevent those things from happening too. So it's not just the big bad things. You know, our main job obviously is to rule out those big bad things. You don't want to have, you know, cancer and things like that, and that's our main job. But if we find other reasons for it, we know how to take care of that as well.
And you have offices all over Southwest Florida. I know kind of your main office is here in Cape Coral, right?
Correct.
But if someone wants to find out more or meet you or figure out kind of what their next step is, what do you recommend they do?
Well, they can always call my office. You're right, I've expanded kind of all over
Yeah.
Southwest Florida. I'm in Cape Coral, I'm in Fort Myers, North Fort Myers. I've actually gone all the way east to Lehigh now too.
Yeah.
So, you know, we like to kind of take care of everybody. You know,
Yeah.
it's what we like to do. So, obviously, like I said, if you have any questions, any problems, and you want to call your urologist right away, obviously call, you know, me or any other urologist that you want to call. But your primary doctor can also help you as well.
All right. Well, Dr. Caesar, thank you so much. We always learn so much
problem.
from you. We love having you here. And again, congratulations on that new baby
Thank you
girl.
very much.
Go enjoy her. Thank you, Doctor. We look
Thanks.
forward to having you back. Up next in today's Real Estate Best Buy, not just one popular property, but an entire community you need to check out. Stay with us.